Great. Okay, so I'm talking about improving access to to early intervention services. Move this forward. It's not moving. Oh, there we go. Okay. All right, so let's just go over some of the demographics as to who Arab Americans are. So when we're talking about Arab Americans, we're primarily talking about an ethnic group defined by common language, which is Arabic. They share a similar history and similar cultural influences. Arab Americans have roots in 22 countries across North Africa and Southwest Asia. 82% of Arab Americans are US citizens, and about 2/3 of those are US born. So obviously, them coming from 22 countries, it's a pretty heterogeneous group. So in terms of diversity in religion, different dialects, their level of assimilation in the United States, their level of education, their SES, and their immigration history. And as far as Arab Americans with disabilities, their exact number is unknown, and that's mainly because of how they're categorized in the census. The census classifies Arab Americans as white, so a lot of that data is lost and exact numbers are unknown. But based on the data about all people with disabilities in the US, there's an estimate that it's around 5,393 school-age children in Michigan with disabilities. There's no exact data on the specific type of disability, so we don't know exactly how many children with autism live in Southeast Michigan. That, I believe, would be helpful. So some of the factors impacting early access to intervention. I'm going to try to be quick, but there's a lot here. So I'm going to start by saying that Arab Americans, especially with recent immigrants, they're in a spot where they may be trying to adapt to life in a different country, and they're still trying to figure out all the ins and outs of things like assimilating to culture and language. On top of that, if you have a child with autism, it may exacerbate some of those difficulties, which makes it less likely that those families are going to be able to access needed services. So one of the barriers is language. And according to the reference studies here, as far as healthcare is concerned, immigrant parents considered language to be the biggest barrier to a positive relationship with the provider and to the development of therapeutic rapport. So professionals also saw that parents were passive when it came to accessing services, and that's probably because of the language barrier gave them that perception. Language barriers can actually hinder parents' involvement in their child's health care and education. And even proficient English-speaking parents struggled with the jargon used by healthcare professionals. And finally, limited written communication in Arabic also presented a challenge in navigating the system, as well as like the requirement to complete forms like intakes and assessments. Those kind of hindered the access to early intervention. Challenges in effective service utilization. So one of the barriers to actually using the services had to do with the perceived differences in the level of care between their host country and their home country. So differences in culture-specific communication styles impacted their willingness to access services. According to this article, I can't pronounce that name, Muslim mothers of children with autism were more likely to avoid healthcare services because of the communication differences. And American providers were actually perceived as being cold, abrupt, spent little time interacting with the patient, and showed little to no interest in cultural background. Another barrier to successful service utilization was just the fact that families were simply unaware of all the services available to them. Next is acculturation. We talked about this a little bit before. This refers to the level with which Arab American families are able to adjust to life in the US. It's pretty complex and nuanced, but overall the literature suggests that families fare much better when they are financially secure, spoke English, and had more social support. And for obvious reasons, the more assimilated that a person becomes to living in their host country, the more likely they are to understand how to access services, to navigate the system, and they're less likely to perceive being stigmatized and discriminated against. Next, we have perceived stigma. So for parents with children with disabilities, this involved feelings of shame due to being ostracized from their community. According to Al Jamal, intellectual disabilities were especially stigmatized, more so than physical disabilities or other types of disabilities. Immigrant families may be embarrassed by their child's challenging behaviors, but at the same time, they're also worried about stigma from seeking help. So it makes it very complicated. This led to many families to hide their children or to isolate them from the community, and it led to them delaying seeking services. And then it's not clicking, sorry. Perceived discrimination. So whether this discrimination is real or perceived, parents of Arab American parents perceive discrimination based both on their status as a minority group and based on their child's disability. Social support. So some people who came to the US find that they actually lost their social support from back home. And other people, because of the stigma associated with having a child with special needs, they're isolated from extended family and their community. And this can actually have an impact on their willingness or ability to seek out services. And then the last couple of things, we have financial barriers. So this is probably not exclusive to Arab Americans, but anyone with a child with disability is going to have added costs in caring for that child. For Arab Americans, while a lot of them are actually financially secure, some others struggle financially or may not be eligible for things like insurance or Medicaid. In addition to that, there's the time spent caring for the child with autism, which may mean loss of income of one parent because that parent has to stay at home. And the last point is the transportation. So obviously, not having a consistent means of transportation limits their family's ability to attend doctor's appointment and attend therapy. So as far as implications for practice, this spanned across a couple of articles, and I tried mainly to focus on families here, but there are a couple of things that focus on providers as well. So culturally sensitive communication, if you train providers to offer or to communicate with families in a culturally sensitive manner, it actually may facilitate utilization of services, and it can reduce perceived stigma and discrimination and help to establish that therapeutic rapport. We also need availability of interpreters in all aspects of care. So from diagnosis to assessment, the intake, all of it, there should be interpreters available. All documents should be translated and reviewed for quality. So I mentioned this before that a lot of them are probably jargon heavy. We should probably be reviewing these to make sure that they are indeed accessible to everybody, including things like intake forms and forms that need to be filled out at the doctor's office or with the BCBA. And then support for obtaining information. So there should be a way for families to know what's out there in terms of services that they can access. And then referrals to parent support groups, preferably within one's own culture. So again, this is something that can be done on the provider's end. And then as far as education directed at the families, families should be educated on the nature of autism. So like what it is, what causes it, myths versus facts, things like that. And then they should be educated on basic disability laws and practices with an emphasis on laws about confidentiality. So we're talking about laws like the ADA, IDEA, Rehabilitation Act, and so on and so forth, because those are going to obviously be very different than whatever laws are in effect in their home countries. And then they should also be educated on the available financial and social resources, such as Medicaid and Social Security, their eligibility, and how to access these. And finally, there should be education on the importance of early intervention and the risk that comes with delaying care. So I think this hits home to like the stigma piece of it, right? Because if you delay care, you're going to see more behaviors. You're going to have a kid who stands out more. And I think that is important for them to know. So hopefully an understanding that their kid can have the best possible outcome the earlier that he or she gets into services, and that treatment is more difficult the longer they wait. Hopefully this will prompt them to access services. And that's it. And I just want to say that this is, again, it's not an exhaustive list. A lot needs to be done in terms of educating providers who work with Arab American families, but it's a start. So that's what I have.